Good morning and good afternoon, everybody. Thank you for joining us here today, whether it be morning on the West Coast or afternoon now on the East Coast. My name is Bianca Frogner. I'm a professor at University of Washington and the director of the Center for Health Workforce Studies, and I'm part of the leadership team for the Award Network. Welcome to our monthly webinar series. We are excited to have a couple excellent speakers today, Drs. Robert Turner and Jason Flatt, who we will introduce in just a moment. They will be speaking about how to improve patient diversity in Alzheimer's and dementia care research. We always welcome ideas for future webinars. You can find our future webinars by scanning the QR code in the bottom right-hand side of your screen. We have an actually exciting lineup of events coming up. They are not quite yet up online, but we're looking for, we have some organized panels coming together around the role of the VA in Alzheimer's and dementia care. We will be hearing from Dr. Van Park at UCSF about some of her exciting work around improving representation of Asian Americans in Alzheimer's and dementia care research. And we hope to also maybe hear from you all early in 2024 as we will put out a call to do some kind of rapid research presentations. So look out for that. I do want to also thank the webinar committee who I'm trying to pull up a slide and it's not quite moving there, who is really behind the organizing of this monthly event. So thank you to all of our webinar committee members. Also, I wanted to just give a heads up to folks that we do have a pilot grant award that will be coming through very soon. So please look out for that through our newsletter and on our website. But more details to come. That will be opening up any day now, and we will be having a separate webinar for an information session for that grant award. So without further ado, I will go ahead and ask Jarman Ye, Associate Professor from UCSF's Institute for Health and Aging, to come on. She will be the MC for today and introduce our speakers.
Yeah, thanks, Bianca. And I'm really pleased to introduce two scholars who I really respect to this month's webinar. We have Dr. Robert Turner and Dr. Jason Flatt. So I'll just briefly read their bios and then let them take it away with their presentation. So Dr. Robert Turner is an assistant professor in the Department of Clinical Research and Leadership with a secondary appointment in the Department of Neurology at the George Washington School of Medicine and Health Sciences. Dr. Turner is the principal investigator for an NIA Health Disparities Administrative Supplement Award that assesses caregiver burden by exploring whether the stress of being the primary caregiver of a person with dementia produces cognitive dysfunction in Black American men. Additionally, Dr. Turner is the co-PI for an NIA grant to host a 3-year Super Bowl conference entitled Black Male Brain Reserve, Resilience, and Alzheimer's Disease, and oversees the Men's Brain Health Initiative, which launched the Men's Brain Health Directory in the summer of 2023. And Dr. Jason Flatt is our second presenter of this month's webinar. Dr. Jason Flatt is an assistant professor at the University of Nevada, Las Vegas School of Public Health, Department of Social and Behavioral Health. Jason is a dedicated researcher who's passionate about improving the lives of LGBTQIA individuals. Jason's current research works to better understand concerns and needs of diverse LGBTQIA people living with Alzheimer's disease, Parkinson's disease, and their care providers. Jason also works with several communities on the RISE registry, the first NIH-funded registry for LGBTQIA people experiencing memory loss or caring for someone with memory loss. So without further ado, I'm going to turn the mic over to Dr. Robert Turner, and I invite the audience to please drop any questions that you may have into the chat. We will reserve the last 20 minutes or so of the hour for Q&A with our panelists and have an open discussion. So go ahead and use that function. Dr. Turner.
All righty. Well, thank you so very much for having me, and I hope everybody can hear me well. And I'm going to do my level best to stay within the 15 minutes that you've allotted me to be able to speak here. So again, I'm from George Washington University in the School of Medicine and Health Sciences. My formal training is as a medical sociologist with mixed methods training, particularly ethnographic and qualitative. And so I'm going to talk this today. I'm going to take the next few minutes and really kind of address this question about equity and equality and dealing with issues that particularly with Black men. And so one of the reasons that we're focusing on Black men that I do is because the Alzheimer's Association, they say that approximately of all the Alzheimer's research, Black Americans comprise of approximately only 5% of the population that participates in research. But of that 5%, they say 75% are women. Which would mean that Black men may be comprised of 1.5% of all of the actual Alzheimer's and related dementia type of research. So given how we don't know very much about how the disease works within that population, caregiving or anything else within that, and that becomes particularly important when we see the development of drugs or we see the allocation of resources. And we take that on top of the fact that I believe it's AARP suggests that approximately there are about 2 to 3 million Black men that provide care of a loved one of some level. And we're particularly interested in what does that do in my work? What does that mean for Black men who are providing care? And we look at their health profiles, and we already know that they have, really poor health profiles in many different perspectives. And so I'm interested in understanding how does caregivers, some people call it caregiver burden, the stress related to that, how does that affect their overall cognitive functioning as well as physiological kind of stress and aging. And so I'm one of the MPIs for the Black Men's Brain Health Initiative, and we run an annual conference, as Jarman has talked about. But within that, we really wanted to say, how do we educate Black men? How do we get people involved with research? And that's one of the real reasons that we decided to do this. And we come from the perspective, our mission is really with the initiative is to understand health inequality that affects Black men as they age over their life course. As we mentioned, there remains a dearth of research and a lack of presence of Black scientists that examine these important kinds of health diseases. And what we've decided to do is build a foundation with an inclusive team of scientists, advocates. We believe that learning Black best practices and engagement tools from other communities, we kind of pull them all together. And we come from the perspective that we know very little about this population. We don't know much about how to recruit, how to engage, how to retain individuals in this population. So what we did is we put together a directory. Right. And we call it specifically a directory instead of a registry, is because we do a couple of things. Is one, first and foremost, we provide education to increase brain health literacy and talk about the importance of research. And as people know, it's been well, documented, written about, where people from the African American Black community have very much distrustful or apprehensive about participating in research, or generally engaging in and interacting with the whole healthcare medical system. And so one of the things that from some of the preliminary research that I have done is that there are a couple of things. One of which is that what do people know about brain health? How do we educate? How do we disseminate information? And that's one of the primary things that we do with our conference. But we also thought it was very important in putting together a directory and trying to increase representation of Black men in scientific research. We need to make sure that we're engaging instead of asking, we're giving. So we want to make sure that we're trying to give as much information as possible, educate the population, find out what do men want to know, what do they know, what do they need to know, how do we increase their health literacy, right? And so a portion of our what we do as our ask is, please register, get involved, and let us know what kind of health education information. You don't have to actively be willing to participate in a research project. You might just say, hey, I want to be a very passive member at this point. I want to sit back and I want to learn. I want to know who you are. I want to try. I want to figure out who you are before I get engaged at all. But then we also know that there are a number of other individuals that might have said, because of their family connection to Alzheimer's, dementia, or because in our situation, they may have played football, or any number of reasons, that they might be able to say, hey, I'm ready. I know enough about brain health. I know that it's important enough. So I'd like to jump right on in. I'd like to register and I'd like to participate when I find something that meets my criteria. You're more than welcome to reach out and let us know about this. And so that's basically what we do from the nutshell. Is we start by saying, hey, what can we give before we start asking you to give us something in return? How do we build a relationship? How do we understand more about the community? How do we know how to engage with you? That's really our number one mission. And through that, educate based on what you're asking for, based on what the community is all about. And as we over time build that relationship, hopefully people will feel very much inclined to get involved with any levels of studies with us. So why does it, basically, why does it exist? But we know that, as I mentioned to you before, historically, Black men are less likely to participate in research studies. They're a population that most likely to receive diagnosis of schizophrenia when expressing symptoms, mood disorders. 4 in 10 Black men age 20 plus have hypertension, higher than even Latino men. So we know that there's a multitude of issues. What we don't know is often, why don't Black men participate? It's too easy to just say, well, because of the Tuskegee experiments and all those other things. From our research, from me being out in the field, one of the things that we have learned, first and foremost, is that when I ask Black men, why haven't you participated in research, over and over and over again, men are often telling us, we've just simply never been asked, right? And so part of what we're interested in is, how do we make the ask? We know that this group isn't the same all along. So is there different ways to communicate, different ways to make the ask? Once we do make the ask, what would their natural questions be beyond that? And so that's why our directory exists. It is both a way to disseminate information. It's a tool to get people involved, but it's a way for us to work within the community to start the conversation. What is it that we don't know? What is it that we do know? We're coming from the perspective that, by and large, whatever the frameworks or methods that people use, or what we think we know about Black men's health, we obviously just don't know. We come from the perspective that what has been historically been happening and working among researchers, at least with this particular community, it doesn't work. So we need to start from ground zero. We need to engage with the community and have them explain to us what's important to them, how to have a dialogue, how to speak with them, how to provide information that's really important to them. So again, our aim is to connect our list of adult men with research opportunities that's designed to improve brain health and achieve, improve all outcome for all men, right? Our directory, we're focusing on recruiting Black men, but if you'll notice that the directory and even our website is the Men's Brain Health initiative, the Men's Brain Health website. Our conferences, we focus on Black men first, but we're really interested in engaging with all men about their brain health. We want to increase participation and increase the health literacy, right? So what we do, we've put together an FAQ page because we thought that that was really important. And the way that this actually developed is something that I think is important for others that are thinking about running a directory or engaging with communities or populations that aren't often, readily involved with research. We created the website. We had been talking for quite a while about the website. We put together what we thought was a really strong presentation. And then we had one of the companies that we work with that is helping us kind of figure out how to market, how to do public relations, how to spread the word about what this is. And so what we learned was by just going out and removing ourselves, but having other people tell us, what did you think about the website, and would you actually register? Would you engage? And what we learned was from some very smart, well-respected individuals, a cross-section of Black population men said, no, I wouldn't register. And we found basically the people that are most willing to register are people who have some kind of connection to Alzheimer's or a problem or concern with brain injury, or those kinds of people that said, yeah, I will. But for the regular, even very well-educated people, what we heard back from them was, love this, understand why it's important, learned a lot about it, but I don't know who you are, right? I don't know if I can trust you. I don't know if, based on what you're telling me, how vulnerable if I give you some information, what are you going to do with it, right? And so that let us know right up front what we needed to do, what we thought we knew, we didn't really know, and we needed to create an FAQ page. We know that there's a whole lot more that we have to be able to do. So again, one of the things that kept coming up in our conversations over and over again is, tell us about privacy. What do you actually do? Everyone talks about privacy, but how do we know that what you say you're doing, we can count on you actually doing it, right? We had to break down the registration process, break down the eligibility, talk about the values that we have as scholars being part of the community when we deliver this information. And so, that is something that we're constantly trying to engage with, trying to figure out ways that we can have people feel comfortable. So we're now creating a series of public service announcements videos that we can post up and we can put on our website, we can send online, but we really want people to get to know who we are before we ask them to get involved with us. So again, on the registration page, is some of the things that we had to really, really think through, because when we're asking people to give us information, what is it we're asking? What is it that we're asking them to entrust us with? And so for us, we don't, when you register to get involved with our directory, you're not directly saying, I want to be in a study. And that was really important for us. Again, you're saying that you're interested in receiving information, or that you are available to be contacted when you fit in a certain criteria that researchers might have. And so these are, as you can see on the screen, what it is that we actually collect. And the way that we do this, what we're building out now for us, is we're having a community science review board. So in order to access or be able to have access to individuals who have said in our registry that, yes, we'd like to hear from organizations or research studies, one, a researcher or research group has to have their IRB already approved. And then the second, they fill out a lengthy, questionnaire and asking for that, and then they get reviewed by the scientific review board before we then say, okay, we will give you a list of individuals that you can contact that have said that you fit within that criteria. Because we want to make sure for us that they are really culturally sensitive, and when they're approaching individuals within this, and that the things that people have said to us, that we've kind of vetted the study prior to them getting involved, so that way we can say with assurance that the Community Science Review Board has vetted them and said that they fit within our standards of being able to work with that particular community. So with that in mind, again, what we do is we ask people to register, stay connected. How can we engage? How can we really kind of think about this as a means of developing the science around recruitment, engagement, and retention within this community, instead of saying that, we know how health works within this community. We're really trying to, from the perspective of taking what we've learned being out in the community, hearing from a vast cross section of people within the community, and help this directory be a living, breathing kind of mechanism that is always, we're learning how to engage, communities are learning how to teach us how to do things better, and that we can stay involved in the forefront with people and respond to whatever it is that they've told us they need. So with that, I'm right at 15 minutes. I'll stop my sharing my screen, and I'll turn it back over to John. Thank you.
Thank you. That was an excellent presentation and perfectly on time. And I will now pass the mic to Dr. Jason Flack.
All right. Thank you for having me. Let's go ahead and get this. So the view still looks good?
Yes.
All right. So thanks for having me. I wanted to talk with you a little bit about thinking around the inclusion of LGBTQIA+ populations, especially in some of the Alzheimer's and dementia care research that everyone's doing. So I always like to start off with just some terminology of what I mean by LGBTQIA+. So this represents individuals that may be a sexual minority or gender minority. And so a sexual minority, this represents an individual who identifies their sexual orientation is something different from being heterosexual. So they may be asexual, bisexual, gay, lesbian, queer, or use a different term. Additionally, they may also be a gender minority. So you could be a sexual or gender minority, or you could be both. And so a gender minority represents a person who identifies their gender identity as differing from the sex that was assigned to them at birth. So this could include a transgender person, a non-binary person. It also includes intersex people who are born with differences in their sexual development. And really what it represents is someone that uses a term where their gender identity or expression does not align with social and cultural expectations based on a person's sex assigned at birth. If a person's gender identity does align with the sex that was assigned to them at birth, then we identify them as cisgender. It's important in the work when we think around asking about sexual orientation and gender identity that we may need to ask it more than once, especially if we're working with, a longitudinal cohort or a group over time, because it does change over time. And here in the bottom, I just show sort of the diversity of terms for the LGBTQIA+. A big piece I always recommend is around cultural humility and being open to using language that the community members endorse themselves. As well, I like to show the gender unicorn that was developed by the Trans Student Educational Resources. And really what this image emphasizes for me is that gender identity, gender expression, sex assigned at birth, and both our physical and emotional attraction, none of those fall on a binary. So we see all of these happening on a continuum. And so it's really important that we think about this when we're trying to answer questions unique for sexual and gender minority populations. As well as this Wordle just emphasizes the diversity of language that's being used by communities to describe their gender identity. And so again, I want to emphasize the importance of cultural humility. People often ask, why should we be thinking about LGBTQIA+ populations as being potentially a health disparity population? And here I just show sort of a very brief timeline that is not as representative for everyone in the community, but highlights some of the moments that the community faced over their life course. So things like back in the 1960s and before, it was actually illegal for LGBTQIA+ people to congregate in spaces. And so it wasn't until the late 60s and into the 70s that the community started to fight back. We also see when we think about wealth and access to wealth that there were not policies in place to protect LGBTQIA+ families, to protect how wealth is shared. So thinking about marriage equality, which didn't happen until 2015. So when we're thinking about older populations or populations that may be concerned around risk for Alzheimer's or caregiving, right? We know that LGBTQIA plus people, this population is growing. So we estimate that at least 3 million are age 50 and older today, over 1 million are age 65 plus. This community is also very diverse. So approximately 1 in 5 identify as a person of color. And then as I shared around wealth, nearly a third or more of the community is living below the 200% federal poverty level. We think about unique concerns and we see issues historically, such as reluctance to seek out healthcare, as well as economic challenges, as well as unique concerns when we think about race, ethnicity, the fact that the community cannot rely on traditional supports, such as marriage and having children, and that they're more likely to live alone. We also are currently seeing many states across the South passing laws to restrict the rights of transgender youth. We are hearing that these laws are actually being broadly applied to all transgender people in terms of their ability to access gender-affirming care. So this creates major barriers for our community around accessing care when needed. And I've already shared some of the cornerstones of successful aging, but we especially see these as challenges for LGBTQIA+, specifically around accessing care and care that's inclusive. So when we think about this, we also need to consider intersectionality in terms of a range of identities. So things like gender, race, ethnicity, HIV status, and if someone's living with a disability. So in terms of dementia, what we currently know is not a lot. There have not been traditionally studies that have asked about sexual orientation and gender identity. Current estimates put it at least 7%, but we've seen studies among transgender people using Medicare beneficiary data showing that rates of dementia are quite high for transgender people, closer to around 20%, compared to around 12 to 13% for their cisgender counterparts. We see also concerns around risk factors for dementia, things like depression, people aging with HIV, and a reluctance to seek out care. And I've already shared some of the unique challenges around being more likely to live alone and not have access to traditional caregiving supports. But the economic challenge is also huge for this community. Alzheimer's disease is the most expensive disease in our country, and over half of LGBTQIA+ people are worried about having enough money to live on. So I encourage you to check out the report by the Alzheimer's Association and SAGE to learn more. Building off of this, we're also showing that the community is reporting more memory problems. This is data using the behavioral risk factor surveillance system, and we're showing that nearly 1 in 7 are reporting that their memory and thinking has gotten worse over the past year. And then we're seeing similar patterns in some of the challenges, like less than half talking to their healthcare provider about these problems. When we explore some of our community studies, we have actually found unique concerns around discrimination. So one study by Dr. Lambro found, right, that transgender people with memory concerns were more likely to report experiencing discrimination in medical settings, which we believe could prevent the early detection of Alzheimer's disease. Similarly, we use some data from Fox Insights to look at people with Parkinson's disease. And we're finding among both cisgender heterosexual women and LGBTQIA+ people living with Parkinson's that they're more likely to perceive discrimination when they're accessing care. So some major concerns. We're also seeing unique challenges for LGBTQIA+ caregivers. So we're seeing that they are more likely, right, to be a caregiver compared to their cisgender heterosexual counterparts. We're finding that a third of them live in rural or small towns, that many of them are providing care to a sexual minority, right? And most are caring for a spouse or partner, but more than half of them do not live with their care recipient. And we're finding barriers to care. So specifically, right, less likely to access respite and transportation services. I wanted to give a shout out by our lead presenter, who we're working on a really unique project in San Francisco. It's called Club 75, or the Community Day Program, which is one of the first solutions around creating a community-centered adult day program for LGBTQ plus people. So this does represent one novel solution that we can think about. So I want to leave you today with a few things to think about. First is, right, we're seeing similar or higher risks for Alzheimer's disease in the community, and we're seeing unique challenges for caregiving and accessing care. And so we really want to encourage people to think about, including questions around sexual orientation and gender identity in their research. I also encourage you, if you want to do this work, to really think about promoting the strengths of the community, being open to learning, and thinking about ways to give back. And I mentioned around the collection of sexual orientation and gender identity. So I encourage you to check out some resources. The National Alzheimer's Coordinating Center, for their recent version of the UDS, added questions around sexual orientation, sex assigned at birth, gender identity to the questions. And so if you want to learn more, I encourage you to check those out, as well as a report by the National Academies of Science, Engineering, and Medicine. So we need more research, and I wanted to highlight some of the work that we're doing right now that's very unique. We currently have the RISE registry. It's an NIH-supported registry that's focused on recruiting and engaging LGBTQIA plus people experiencing memory loss or Alzheimer's disease or another form of dementia, as well as their caregivers. And so you can go to the riseregistry.org to sign up, as well as to look at local resources in your community. We also have a new R01 that just started last month that's going to be focused on enhancing measures and characterizing sort of the caregiving experience. And so our goal is to create new measures that will be more inclusive of the LGBTQIA plus caregivers of people with dementia. So I wanted you to stay tuned, as well as some work that we're doing funded by the Alzheimer's Association. We currently have a study where we're recruiting participants. So people age 50 and older can call, and we're exploring issues around memory and thinking and caregiving concerns. So I encourage you, if you do this work, to think about advocacy and supporting junior people. This is such an important area that we believe needs additional attention. And so I'm so grateful for the Award Network hosting us today to highlight the unique needs of communities. And I encourage you to think about supporting junior people to do research thinking about the LGBTQIA plus community, and especially how they can work more in accessing healthcare resources and related programs. So these are my collaborators and my funding, and I have no conflicts to report. And I think we're ready for our discussion.
Thanks, Jason, for that fantastic presentation. And at this point, I welcome attendees to drop some questions in the chat box. And while we give folks a minute to do that, maybe we'll kick it off with one question to Robert and Jason, just taking a little bit of a personal turn. Can you talk about some of the personal experiences that have influenced or informed the pathway you've taken in your research to do the work that you're currently doing now? Robert, why don't we start with you because you're laughing?
that is a great question. And let me start by first saying that I just want to take my hat off and just acknowledge Dr. Flatt. I think your work is amazing. I think you are bold and brave, and I have a lot of respect for what you're doing. So I'm really glad you are who you are. Yes, for sure. Jarman, you know me well. And so basically coming out of sociology, let me answer the question this way. Coming out of sociology, I was completely discouraged to do a lot of what I'm doing now, because they would say, well, if you're doing called me search, right? I'm a former professional football player, and so I'm studying about brain health and concussions, repetitive head impact, and so they were like, once you finish that, what's your next thing that you're going to be able to do if you're only studying yourself? And really, my work, and I will say working in aging in particular, right, and in brain health, has allowed me to take my personal experiences and embrace them, and take what I've learned from being a Black man in America, so to speak, being a former football player, and understanding that there's a lot of people who are just like me, and we need answers. We need help. My dad has Alzheimer's, right? I'm his primary caregiver, right? And so understanding people who are like me and what we're going through, and understand taking care of someone, is something that I opened my eyes and realized that there's not a lot of people out there doing this kind of work, but there are a lot of people out there who need answers. When we think about playing football, we think about CTE, we think about all of those other things, right? We think about Black men's brain health, the stress that they have, all these other things. People ask me all the time, where do I turn to get information? What can you tell us about this population? And that is why I feel like, it has driven me to this space. And I'm very thankful that gerontology, the aging community has said, hey, there's a place for you here to ask those questions. And we want to support you. And in our situation, we have an emerging scholars program where we're helping cultivate and raise up other people, not only Black folks, but other people that can get the skills and the mentorship to go out into their own communities and ask these same kinds of questions.
Thank you. Jason?
Yeah. So I think you know a little bit about this. I'm trying to think. So personally, right, I think the interest in dementia came from, I worked in a assisted living and advanced care facility in high school. So that was my initial kind of exposure to it. And then when I went back for my doctorate, my grandmother was having early stage like memory loss. And so that sort of motivated it. It wasn't until I was very active in the LGBTQIA plus community back in sort of Pittsburgh, Pennsylvania, but it wasn't until I moved to San Francisco and had an opportunity to meet some incredible leaders, elders that have just been doing, fighting for my rights, fighting for, to be able to authentically be who they are. And I did 20 interviews with LGBTQIA plus seniors throughout the San Francisco Bay Area back in like 2016, and it changed my life. I went into it a little like, am I the right person to do this? And then came out of it like honored to get to do this research, and just, I was like, these are my people. These are my people. And it's, those stories, spending like 2 hours in their home and just learning about their experiences, and these stories stay with me, and I remember them, in my daily work. I just like hear their voices, and so it's something really powerful for me, and I'm so honored to get to do this work. And currently my best friend here in Vegas is an older trans woman that was at Stonewall, and we just like hang out, and I hear stories, and right, and I actually hired her to help me recruit, and it's such a rewarding area for me personally to do this work and to be able to give back in a way that I hope makes change that also improves my own life. So yeah.
Yes, I love that. We do have a question from Kim. Kim writes, thanks so much for sharing. Great choice of words, directory versus registry. I'm curious if registrants directory users can contact others within the directory, since it is often a feature of a directory. Also, I noticed information missing questions on sexual orientation, identity, and gendered expression questions. Will those be developed later? No plan to collect that information, or just not shown?
Oh, wow, these are great questions. So about sharing of information between one another. For one, we did not write that in the IRB, but two, this is not a research project. So maybe I think what we probably will consider doing, we definitely will not share people's information, but maybe what we'll wind up having is some kind of like community board where people can share questions, concerns, experiences, make themselves available for other people to contact them, that kind of thing. Again, we're where we're coming from, and we want to make sure that we are being very sensitive and aware of how people are thinking about health, right? What we might consider to be kind of a standard practice that other people are doing and best practices, we really don't know if how this community would think about it. And so I think, if anything, I'm probably going to be a little bit more conservative and always engage and ask people what they want, what they think. I'm a qualitative researcher by training, so I'm really big on focus groups. I'm really big on interviews. I'm really big on community engagement. So constantly more information that we can find how people are thinking is better. So that's probably how we'll take the approach of this. Right now we're just coming out of beta stage. If anything, we're going to make a full-on launch at our 2024 conference in Las Vegas during Super Bowl week. So if anyone can make it, we're going to be there, I think, starting from February 5th. Would love for you to be there.
I can
Love
make
to get
it.
your feedback. All right, good, because we got something special for you as well. But the second question, I would say, it was actually a question that I wanted to ask Jason, because I need more understanding. I'm like, when is it appropriate? How is it appropriate to ask these kinds of questions to an all male audience, right?
Mhm.
Because I'm a little concerned in one respect. Like, I don't want to alienate people. I want to be inclusive, but at the same time, I'll give you just a little example of what we faced with our last conference. And people overwhelmingly, when it was at Arizona, people said it was the best conference. It was amazing. But we had a very small but vocal group of individuals that emailed, got on the phone and said, this is supposed to be about Black men's brain health. Why am I seeing other people? Why am I seeing women on the stage talking about men's health? Why am I seeing Hispanic people talking about this? It's supposed to be about Black men, right? And so we had to write a statement about inclusion when we really try to be sensitive to what they were saying, but then also saying we're looking and we're open for everybody who can help us find answers to this community of problems we're open to engaging with. So we took a very firm stand. But that being said, when I'm personally charged with putting the panels together and finding speakers, I'm really thinking about, can I have Black male representation? And so walking that line is really important to us. And and how to do it, when we talk about, the issues that Jason just brought up, I really don't know how to do it. It is something that's really important, but we do need some guidance on how to be there, because we want to be as inclusive as we possibly can. And we need to be able to share that message with people.
Yeah. I think doing some more formative work is going to be necessary before just rolling out the questions, right? Because we think about the cultural acceptability, but even the wording, right? Of how so there are different terms that may be used, right? For communities to refer to sexual orientation or identity, right? And so I could see this, right? We're doing pieces where the example, right? We're translating into Spanish, right? And having to learn around the correct language to use, right? And make sure not to use stigmatizing language as well. And so I think that that's a piece that we would want to do with Black men, right? And at least based on my own exposure to some of that, there is stigma around sexual orientation and gender identity for the community. And so I think we would want to, right, ask that in a way, almost I'm thinking like either one-on-one interviews or doing some formative work to get at, right? Acceptance of these questions. And I wouldn't want to roll them out and then people be upset about it or feel like you're using language that's not appropriate for our community or why you're asking this. Typically, if you do include the questions, they would go in the demographic area, right? But that would be something to want to ask. Would it be more appropriate? Typically these are identities, so that's where we ask them. But if you ask questions around sexual behavior, right, would you want to have questions somewhere there? That's something to think about. Or if you don't ask that at all, right, then that would be a piece to consider. I think community buy-in is going to be important. We do write a script at the beginning of it that kind of explains why we're asking these questions. But that script might need to be adapted based on sort of the community's input and thoughts. Right? It's these pieces we do with many measures of we think about cultural acceptability and the wording. And so I would say these questions have not been tested, right, with the Black community to understand around language, right? And so I think that would need to be done. We're in the process of kind of doing some of this work, but I think more needs to be done. So I'm happy to talk with you about it, think about it, if there's opportunities for that. So yeah.
Sounds like we need to write a supplement, some type of
supplement to
supplement.
explore. And right. And when you say Black men, what about Black trans men, right? And would they be included, right? That's the first thought. Or how do we navigate, right, Black gay men and their experience, and some of the language, around that. So it is really, you're right, we need more research in this space.
Thank you for that. I appreciate that.
Yeah, hand from Bianca.
Hi, what a wonderful and rich discussion. And sorry, I have to ask it out loud because I don't actually have access to the Q&A function as a panelist. But really, what a wonderful discussion. I am just curious, Dr. Turner, as with your conversation as it comes about, as you talk about other folks who are on the stage or speaking to the audience who may not look like the people that you're talking to, how mixed race people may be. And I ask that as a mixed race person myself, because at some points in time, mixed race certainly has folks may have slightly different challenges. They also may not be perceived and looked at as someone who might be part of a community. So I'm curious about that. But then on the other, another question I have for both of you is how the experiences have been of people who have been in the registry and actually participated in research studies. Have you heard back from them about what their experiences have been like to be part of those studies? And has that been used in any ways to maybe help recruit other people or reflect on even how to improve research studies?
Okay, so I'll answer your first question first is that we're just really coming out of beta, right? And we're going to test it until February when we do the actual launch. So I don't have that information. We haven't been able to go out to people because we haven't asked them to get involved with studies or made themselves available as of yet. So that's not something that I can address. But I will just take a brief moment to answer your question about biracial or any other self-identified when it comes to race. And as you notice, it's the men's brain health registry. Well, what we've done is we basically wanted to make sure from the very beginning that we didn't exclude anyone who wanted to be involved. We're focusing on recruiting Black men, but it asks you, how do you self-identify in any way that you want? Now, the thing that's so interesting for me, at least, about this, and as we are starting to think about this, is those of us who are older, particularly in Black community, right? I was raised from a very young age that's basically was about the one drop rule. As long as you have one drop of Black blood, that you were Black. There was no such thing as biracial. And as a matter of fact, it was a very people who were, kind of fronting they could very light skin or trying to pass, right? But fact that, they grew up in a Black community. So it's for us, it's really about, it's really more about how you self-identify, how you feel comfortable, how we can engage. But really it's about being that sensitive, right? Sensitive. Making sure that we are figuring out how to ask questions in a way, like Jason said, that is more inclusive instead of exclusive. We don't want to alienate, but we also recognize that it's very, very, very important to get people who are generally underrepresented in research, to get them engaged and get them involved. And that's why I said from the very beginning, we're taking it from this perspective that, we're not even sure if we have an accurate model of what a Black men's health is like, right? So we're starting from the very beginning in challenging any and everything that we know to figure out how do we get that information to help us better understand how people live, think, and go about experiencing their health on a daily basis. So
I have another
that's my
question.
That's it. Yeah, but I think, Jason, can you talk about the question she had asked, people who have been in the registry and been in a study?
I'm trying to think of, I can't really. Yeah, I don't have any knowledge of sort of those pieces yet, right? We have our registry is actively kind of enrolling people, but we haven't actually engaged them in any kind of research studies yet. We are learning more, like really what our focus right now is on, like more like learning about the ideal ways for recruitment and engagement and sort of the building of trust, right? That's where our focus is for right now. But yeah.
Yeah, that was one of the questions I wanted to ask. I feel like I've recently seen lots of calls for things that want community engagement, which is the right word, but it seems like sometimes it's being euphemized to mean recruitment pipeline into RCT, randomized controlled trials. And both of you talk a lot about rapport building, trust, really spending time to listen to the communities. What are some of the barriers that you've encountered to establish that bidirectional trust and sustaining it, given some of the power dynamics between academic institutions and communities?
Trying to, like some of the pieces around, it's so complex, right? In what we hear in terms of, it's not like one issue for a person, right? There's one of the big things we've heard, and I especially think about my time in San Francisco, is reluctance to participate because how long will this be around? So the fact that something doesn't really have a continuity in its funding, it's like, oh, this is something hot and new, but in a year or two, it's going to be gone. So there's that reluctance of like, why should I invest my time if this is just sort of a one-time kind of thing? We're just noticing something really unique is that, with COVID, and there's a huge reluctance to kind of engage virtually. People want in person, right? They don't want to come to a Zoom. They don't want to do, some of these virtual activities as much. So we're seeing some barriers around that. Trust-wise, specifically for certain generations, there is some reluctance to disclose identity. They've actually experienced discrimination because someone found out, right, that they were gay or lesbian or transgender. And so there's that distrust of like, why do you need to know this? Almost on the opposite end, why are you creating a registry just for LGBTQIA plus? Why can't I be just part of a regular registry? And why do you need to know this? Right? It's almost convincing them the same way we're doing to researchers in other communities. We're like, no, you need to be included. You need to understand this. Of like sort of why are there these unique opportunities and why we need to make sure you're included in research. So we're having to do a lot of that, but we've learned it's really more of like a grassroots approach of like community partners, building trust, gaining entree into communities that, right, you have sort of someone that already has trust with those communities. So we're learning about that. It's more, I feel like there's been a huge shift, but I think it's also right. I moved this work to national versus I was in San Francisco. It was a lot easier because I could just go. And so that's been another shift of it. And there's a lot of distrust from our community, and building trust, it takes time. And unfortunately, the grants we get, even 5 years, I don't know if that's enough time to build trust, right? And if we don't have the continuity of funding, that's another trust issue. So, yeah.
Yeah, I'll jump in real quick. I know we were at the top of the hour, so we're supposed to be done, but really, I'm going to echo some of what Jason just said. And one is that one of my biggest barrier is that I don't have enough time to listen. Right, they're funders have their schedule, right? Grant reviewers, my department has its schedule. Like, everybody's got a schedule, right? But you're trying to say, okay, I need to go out and I need to hear from folks. That becomes a challenge. And I think the other big challenge that I personally have, and it might be somewhat similar to Jason and where he's in his community, is that there just aren't enough of me personally to go around. Right. Like, I hear all the time, people will say to me when I'm in the community and they say, hey, listen, this is the first time that it's not the first time that George Washington has been here, but it's the first time that a Black man who lives in my community has come and talked to me about my health. Right. And they're like, you know what? They're not going to say. And I think the big problem is that we somehow or another, just because people are willing to work with you means that you've gained their trust. No, that doesn't necessarily mean that at all. But at least they're willing. And I've even had people say to me, hey, listen, you know what? Because of who you are, because you've taken the time, I'm willing to give you a shot. Right. And so I just feel as though we need more resources. We need kind of in a way, when you're dealing with a community that historically has not been invited at the table. I learned that maybe instead of inviting them to our table, we need to figure out ways to have them invite us to their table. And that just takes time.
Yeah.
Yeah.
On that note, Bianca, did you want to say something?
Yeah, I just want to say thank you again. This was really a wonderful conversation. And I just want to remind folks too, this is recorded. So we will certainly make sure if people hear it, because I think there's so many lessons to be applied across all sorts of research that we do in this network. Just lessons about how we can improve diversity and think about inclusion of all of our different research subjects, and the use of any data that comes out of the Alzheimer's kind of research space, and being aware of some of the limitations and challenges of making sure we have the right folks in those studies. So I just wanted to say personally, thank you so much for taking this time today to speak with us. And thank you, German, really, for hosting us and carrying us through the conversation.
Yeah, thank you, Dr. Turner and Dr. Flatt.
Yeah, thank you.
Thanks for having me. It's wonderful.
Have a wonderful day, everybody. Take care.
Right.
All right. Bye-bye.